Fauci warns that patients not requiring hospitalization for virus could suffer long-term effects. There are many reasons the United States is having a difficult time fighting the coronavirus. One is that Donald Trump continued to downplay the disease in the earliest days of the pandemic and still does occasionally. He said it would go away on its own and compared it to the flu. Despite the virus claiming more than 170,000 deaths, there are still many out there who refuse to see it as a viable threat. But it's not just Trump's words enforcing this viewpoint. It's also a number of people who never need to be hospitalized as they have flu symptoms. This encourages the flu spin on the virus. However, doctors are finding that even patients who aren't sick enough to require hospitalization still experience long-term health issues. While the patients may be recovered and no longer testing positive to where they can return to their normal lives, they can still suffer long-term effects, including fatigue, breathing issues, and cardiovascular problems. A recent Centers for Disease Control and Prevention report noted that overall, 1/3 of COVID-19 patients have long-lasting symptoms. That speaks to the fact that this is still such a new disease that we just don't know enough about it yet, and that's one issue in trying to treat people. The virus just isn't fully understood yet. It's been in the United States barely more than 6 months. There's a chance that there are further long-term effects no one has discovered yet since the disease is still so new. At a time when some schools are reopening, the long-term effects being an unknown is more crucial than ever. One of the arguments for sending kids back is that typically kids and teenagers don't experience the virus as severely as adults. But there's a chance they could be dealing with some very negative health issues further down the line. Dr. Anthony Fauci, the nation's top infectious disease specialist and a member of the White House Coronavirus Task Force, said earlier this week that thinking a positive diagnosis for COVID-19 isn't that important if hospitalization isn't required is not okay. We better be careful when we say, young people who don't wind up in the hospital are fine, let them get infected, it's okay. No, it's not okay, Fauci said in a briefing. In individuals who are young and otherwise healthy who don't require hospitalization but do get sick and symptomatic enough to be in bed for a week or 2 or 3 and then get better, the doctor added, they clear the virus, they have residual symptoms for weeks and sometimes months. Fauci sees it as troublesome, adding that patients who are thought to be recovered have a substantially high proportion of cardiovascular abnormalities, evidence of myocarditis by MRI and PET scans, and evidence of emerging cardiomyopathies. There are also other ailments that keep recurring in patients who are thought to have recovered, including fatigue, breathing difficulties and reduced lung capacity, general aches and pains, and even cognitive issues in some instances. To think we haven't even experienced what can happen 1 year, 5 years, 10 years later makes the picture more frightening. I'll guarantee you, if we have this conversation again 6 months to a year from now, added Fauci, we'll be reviewing the literature about talking about the long-term deleterious effects of non-hospitalized patients.